Good morning. I'm Allah, the first year medical student in University of Rocademia. Today we're going to talk about the omega-3 fatty acids and the treatment of Alzheimer's disease. And thank you very much for attention.
Secțiunea interne mențiune Abdallah Reda El Sayed.
Good morning. I'm Allah, the first year medical student in University of Rocademia. Today we're going to talk about the omega-3 fatty acids and the treatment of Alzheimer's disease. So, first of all, we're going to talk about the etiology of Alzheimer's disease. We're going to talk a little bit about the pathogenesis. And I'm going to mention the objectives, the methodology, and then we will see how omega-3 is used in the treatment of Alzheimer's disease, and then the conclusions and the recommendations. So, first of all, Alzheimer's disease was discovered more than a century ago, in 1906, where the first patient, as we can see, is Auguste Deter. She was described by the German psychiatrist Alzheimer. And nowadays, Alzheimer's disease is one of the most dangerous forms of dementia, with the most prevalence ranging from 60 to 80% of the dementia cases. We got about 36 million people nowadays living with Alzheimer's disease, and this number is about to double in 2030 to reach 66 million, and in 2050 it might reach 115 million. So, what about the pathogenesis of Alzheimer's disease? The major landmarks of Alzheimer's disease is the neurodegeneration, and this occurs due to the oxidative stress, which leads to neuronal loss, beta amyloid peptides, tau tangles, and synaptic degeneration. And as we can see here from the figure, that there is something called the lipoprotein E4, which is a very, very important risk factor of Alzheimer's disease. And it causes antioxidant deficiency, and this encourages the reactive oxygen species to act, and all of these things finally lead to the neurotoxicity. So, why exactly omega-3 fatty acids? We know that the synapses which are found between the neurons are rich in unsaturated fatty acids, including docosahexaenoic acid and eicosapentaenoic acid, which are omega-3 fatty acids. And in addition, the oxidation of such species of unsaturated fatty acids can be indicative of the oxidative stress, because they produce F4 isoproteins or neuroproteins, and we can see the structure here of the docosahexaenoic acid, the eicosapentaenoic acid, and a neuroprotein. So this study was done in order to review the effect of using the omega-3 fatty acids on the treatment of Alzheimer's disease patients. And so a thorough search was done using PubMed and PLOS ONE in the recent decade in order to see the clinical trials that are done by conducting a treatment of omega-3 fatty acids on Alzheimer's disease. And these were the keywords used. So, in order to use omega-3 fatty acids in the treatment, they are very abundant in the fish oil extract. And so, as the fish oil extract is very rich in polyunsaturated fatty acids, including the DHA and EPA, which are the same ones that are found in the synapses of the neurons in the brain, so it can be used as a source of omega-3 in the treatment. And here we can see some of the studies that were included in the review. So, for example, here in 2006, a study was conducted with 204 patients, 174 completed the study, and they were mild to moderate Alzheimer's patients. And the treatment of omega-3 fatty acids, including DHA and EPA, were actually kind of significant in the MMSE scores. In 2010, another study was conducted with 402 patients, ending with 295 patients, by administrating the omega-3 fatty acid DHA, and the results were not significant. But in 2013, here is a very important point, so that the treatment was conducted in patients with the apolipoprotein E4 allele. 6 of them were positive and 34 were negative. And it would notice that the result of the action of the omega-3 fatty acid is different according to the allele. So if it was positive, 31% more, the mean plasma levels of the omega-3 fatty acid in the blood were 31% more than the negative species, and for the cumulative B oxidation, for the negative allele, it was significant. So the presence of a positive allele was actually affecting the action of omega-3 fatty acid, decreasing its metabolism. And the final study was in 2014 with mild to moderate Alzheimer's disease patients with the treatment of omega-3 fatty acids only, or omega-3 fatty acids along with alpha-lipoic acid, or placebo. And it was found that that was the best treatment, the omega-3 fatty acids used along with alpha-lipoic acid. So the conclusion that we reach is that the results of these trials show that omega-3 fatty acids, in some cases, they can improve the cognitive abilities of the patients and their behavior according to the different tests that were in the previous table, like Alzheimer's disease assessment scale or Alzheimer's daily living, the assessment of daily living, and so on. And in other cases, they didn't. And the best treatment was that conducted by using the omega-3 fatty acid along with the alpha-lipoic acid. Finally, we can see that due to the effect of the apolipoprotein E4 plus allele affecting the metabolism of DHA, it can be used to indicate whether this allele is found in the patient or not by measuring the rate of metabolism. And so these studies were actually conducted on a small range of patients. So further research is recommended on a wider range of patients with more variety in order to test the effects of omega-3 fatty acids on the treatment of Alzheimer's disease, and for the sake of finding a proper cure for Alzheimer's that's not found until this very moment. And thank you very much for attention.